Hello, my name is Hayley Wardle. I'm the Director of Quality and Patient Care here at Ashgate Hospice Care. I've just stepped outside into the sunshine, making the most of some blue sky and warm days, just to bring you a bit of an update as to what we're doing here at the hospice in relation to our response to the COVID-19 crisis. I'm actually sitting just outside our daycare unit, which is sadly closed up, unoperational at the moment, obviously waiting for this to be over so that we can reopen to our patients and their families. But all of the patients from our daycare services are being contacted every day by phone by our team of nurses, so we're keeping that regular contact with them. Other things that we've had to do here at the hospice are we've had to open up a corridor specifically for patients with a COVID-19 diagnosis or for those with a suspected diagnosis, just to keep them and our staff and other patients completely safe. People tend to wait there for swab results to come back, and once they're either confirmed positive or negative, they'll either come back onto the general ward or will continue their care there. We're just thinking about actually opening a second corridor. The 4 beds that we have at the hospice are almost full on the COVID wing, and so I think in the next few days we're going to see ourselves open an additional facility for other patients who show symptoms when they're in our care or are being admitted into our care with a COVID diagnosis. We're doing lots of things out in the community. Our community nurses are still continuing to support people, whether that be by telephone calls or FaceTime or actually home visiting if we need to. We're supporting GPs and district nurses. We're also reaching into the hospital to support the staff there who are struggling with what they're having to deal with on some of the wards. And our supportive care have been going in and doing sessions with teams at Chesterfield Royal Hospital. That's something we're going to roll out very soon into care homes and potentially domiciliary care providers if we're able. We've had such a wonderful response to our appeal. People are so generous. People in the local community and our own staff and fundraisers are actually doing some amazing things to raise money for us, for which we are so grateful. But of course, as I sit here in the sunshine and everything looks smiley and wonderful, I'm still sitting looking at a hospice building that is having to deal with people at the end of their lives, people with a COVID diagnosis, people with complex symptom controls that we're continuing to care for day in, day out. And that's why we really need you to respond to our urgent appeal. Of course, our fundraisers are still working hard, but our shops and retail outlets and cafes have had to close. A lot of our large-scale fundraising operations have had to be postponed, and that's obviously making a huge dent in our fundraising and our funding. So I would ask you please to get behind Ashgate. We're here for you. We've been here for the last 30 years. We really want to be here into the future for you. So please support our appeal, do whatever it is you can, however big or small, and support the staff and the patients and the families here at Ashgate Hospice. Thank you.